Well, thanks for that introduction. And first of all, thanks for having me on your webinar today. I think that might be a little bit more aspirational than what we'll do in the next few minutes. What I will be able to talk about is the consumer-driven health plan and how we are at least attempting to be much more consumer-driven. I've had the privilege of working at Premera for the last 10 years and more recently on planning sort of where we're going in the future, as well as running our innovation program. And it's in collaboration with our individual market, sort of in response to the ACA, that most of the ideas that we're going to share with you come from. But first, a little context setting. Premera is a lonely little health plan out in the Pacific Northwest, where we are home to tech, outdoors, and consumer brands. We're headquartered just outside of Seattle, Washington, but we also run the Blue Cross Blue Shield plan of Alaska. And we have LifeWise of Washington, which is our individual brand in Washington, and LifeWise Health Plan of Oregon, which is an employer-based and an individual plan in Oregon. So we're kind of covering the map there. As I mentioned, it's home to tech stocks and outdoors and consumer brands, and here's just a list of some of the companies that we call customers today. This group has grown over the last 10 years. And I can remember starting here, and we only had one on the page. And part of the privilege of working with organizations like this is that they push us and they prod us to be a lot more innovative and out there. I heard some of the demands of Google and other organizations like that. They have employees that are constantly looking for different things from their employer-employee relationship. And they also have different demands on what makes them attractive. And so consequently, that's helped us think differently about our markets in response to some of the upcoming trends. So kind of behind the scenes, and I think some of what you've already heard this morning, afternoon, depending on where you're situated, is in response to some really big forces in the marketplace. And there's a lot of press around what's happening in healthcare. I'd like to just focus in on three key things. One is the potential for explosive growth in the individual market. Individuals purchase a lot of different things. They purchase through Amazon, et cetera. But healthcare is not something that, at least for coverage, that they've really been in the business of doing for many years. And with the ACA, we expect our market size in the individual membership to double between 2013 and 2014. That's an incredible amount of people. Many of them coming in who have had maybe limited access to care. Maybe they've been on Medicaid, maybe they were uninsured for a period of time, but maybe less experience with the system. And suddenly faced with an ability to get subsidies to purchase healthcare benefits, and then having to make decisions, that's really going to drive a need for a better understanding of what to do. Some of the tools we were just talking about, I think, could be really helpful for these environments, and I think are being tested out on Medicaid populations as we speak. And so employers, in response, are also beginning to drive the same way. Healthcare benefits are incredibly costly, and they don't want to see them go up. They'd like to spend their time doing what they do for a living, not worrying about who's going to get covered, et cetera. And so the net effect is that employers have been driving a heck of a lot more experimentation, both with respect to how they design plans for their own employees, but then also what they want their employees to do. And so in some ways, offering them opportunities to purchase coverage directly through something like a private exchange allows their employees to have more skin in the game and have more ability to guide their decisions directly, as opposed to having an employer standing in between them. And then the last thing, sort of big trend we see, is really health plans rising to the opportunity. Many of them are out there actively seeking new ways of talking to consumers, talking to people in the marketplace, talking to employers, and offering tools and techniques to take advantage of what they see as really a life or death, adapt or die kind of situation. And so some of the recent press where you've seen big shifts and things happening where Walgreens moving its membership, its employee base onto a different plan, which created quite a bit of backlash, or IBM doing what they did recently with retirees. Both situations where people, you can see, really are experimenting with different designs and different effects. So the secret to becoming consumer-driven as a health plan isn't really much of a secret. I think the first two examples you heard are pretty good examples of what you can do when you're designing a product and putting it out in the marketplace when you have consumer needs in mind. For health plans, we're a little bit later to the game. And so for Premera, the last 2 years, we've really been trying to understand what are the elements that we need to bring to bear to make ourselves more successful. And luckily, we have great examples like Target and Starbucks and others, Procter & Gamble among them, that have paved the way through decades of research and design and development. So we've boiled it down to four basic things. One is that you need to understand the consumer's needs. Not understand the consumer, because that's interesting, but understand what they're really about. And what they're looking for, and where there are needs that might be unmet. And once you've understood those needs, then you've got to choose the one that you think you either are uniquely situated or you think you're well situated to be able to fulfill. And then from there, you design a solution, and then hopefully, ultimately, distribute it to the marketplace. Now, while that sounds really simple, it's really a newer idea in health plans. We've spent most of our time looking at the cost of care and how we help people, if you will, manage their health and manage the cost better. But it's all about we'd like you to do, as opposed to we understand you and what you're looking for, and we need to help you do what you want to do. And so that's kind of the big shift happening. So like many others out there in the marketplace, we have invested heavily in segmentation. And I've heard from a number of my colleagues that they've done that too, but they've been asking me, so what'd you get when you did that? What was the benefit of it, and where did you take it? Because we've got segmentation, and that's helped us with our communication, but we really didn't go much further with it. And so let me try to describe what we've been doing with our segmentation. First off, we purchased national segmentation data. So this is something that anybody could purchase from the Futures Company, and that gave us a sense of 6 segments based on national purchasing patterns and behavior that we could use and then we actually typed everybody that lives in our markets, and in particular our membership, around these 6 segments to figure out which one they belong to. But that was a little bit generic, and so we extended this 6-segment model to 22 subsegments that are unique to our markets and our population. And we did that because we figured the Pacific Northwest was going to be a little bit different, but also we wanted to be able to really understand what was going on with them and be able to then get behind what some of those needs would be so we can look for places that we could add greater value. We then went even further into what we call the Premera Consumer Experience Roadmap, where we tried to map their use of our existing service and product over the course of a consumer's life cycle with us and what their experiences were. And we developed these then 4 or 5 steps along the way that we could really drill into. Over the course of a series of focus groups, as well as kind of intense interviews, we've gone from the basic experience map to really what the consumers want and need, what their current experience is, what they would desired experience would be, and even boiled it down to quotes, things like "don't judge me, meet me where I'm at," to help us guide our own thinking around, well, what do we need to do? We've tied each stage of the journey map to various departments and functions within Premera and have begun to change the way that those departments operate. When we make modifications to process or procedure, we start with the journey map and we say, well, what is it that the consumer wants from us at this stage? And we start to figure out, okay, so how can we design that process or procedure to better meet what they're looking for? And so how this manifests itself in the marketplace, in some ways, is sort of the growth of simple tools. So from the other direction, from Zipango or iTriage, the health plan is saying, gosh, we need things like this because this is where consumers are hoping to connect with us, and this is the kind of information they need. So back to my context setting message, though, since we are in the Pacific Northwest, we're fortunate to have a number of of technology companies out here and some freelance technologists. And so we're able to draw on their expertise to build some of our own applications. If you go out there today, you can see Juice featured. It was something we co-developed with a company called MindBloom, which is a way for people to track really their well-being, since we were hearing that a lot of consumers were looking for additional ways to interact, but not in a judgmental. And so Juice was an application that we co-developed and launched as a result of looking at the consumer experience, looking at their needs, and trying to figure out a way to fulfill it. Turning to how consumers engage with the health system, this is a sort of strange footing for a health plan. We're really often behind the scenes. We're what consumers think about before and after they go to see the doctor, right? Do I have my insurance card with me? That's much thought that goes into it. Is my provider covered? And then they have an interaction, and then afterwards they deal with the bill, or they deal with whatever the next step would be, and that's usually where they interact with us. And the challenge is that then their experience with us, and we got this a lot from the consumer experience roadmap, is in denials or negative interactions. And it's sort of almost like running through that speed trap and getting caught by the police before you even realized that there was a speed trap there. And so we wanted to try to turn that dynamic a bit and think about how would you design the ideal system in which you put the patient in the center and you worked with them more holistically on what they needed. And so we have begun piloting programs that have members of Premera really working alongside associates of the health plan to design programs that meet their needs. We've gone out into the marketplace and interviewed people in their homes, looked at the kinds of medications that they're taking, looked at the kinds of interactions that they're having, and tried to see if we couldn't be more active in approach than just calling them up and asking them if they need help, or showing up after a procedure is performed kind of when they don't really need the information, or trying to troubleshoot their customer service issue. So it's moving from the, gosh, we're sort of part of this fragmented system and we just show up periodically once you're done, or maybe you think about us beforehand, to how do we take the journey with you? How do we really put the health back in health plan? And it's led us to more recently look at, are there alternate care models that we should look at supporting in our marketplace? Looking for different ways that consumers could actually engage in the marketplace, and are examining some potential experiments for 2014. A more practical way that this has worked in our favor, I think some of you may have seen there's sort of recent information about the exchanges, et cetera. We used this whole technique of the consumer-oriented design, the looking for needs and trying to meet them, to come up with our branding and marketing strategy ahead of the exchange, and designed a whole communication package for our LifeWise Health Plan of Washington that was trying to find the folks that wanted more from a health plan than just pay my bills, that were looking more for a health partner. And that's led us to experimenting with things called Fit Mobs, where we actually got a bunch of LifeWise Health Plan members together to experience different types of healthy activity, from trail running to boot camps to yoga, lots of different stuff like that. We've experimented with an ambassador group of people who are, I would say, active, healthy, not extreme, who show up at various functions and places to try to enroll people in other healthy activities, without really any motivation for rub-off on anything other than the brand, but just a part of trying to be a different health plan and meet people where they are, so that we can engage with them differently. So my preface was that it's pretty big thing to say that Premera is already a consumer-driven health plan. I think we are making great strides and we're getting there. The nice thing to see is that we're starting with needs and trying to figure out ways in which we can actually meet people's needs. What we haven't done yet, and what you can see a lot of the really great programs out there do, what great products out there do, which is to start with maybe even more of a blank slate. When you think about health and you think about consumers, what are they really after? Our starting point still is the health plan. We have an existing product and we have existing services that we'd like to sell. And so in some ways that anchors us to the older world. I think what you're going to see from health plans in the near future is more of that, gosh, what would we really do if we were unconstrained? And even if we had to go over on the side and create something completely different, what would that really look like? And I think you'll hear more and more of that from other health plans. I know we will be engaging in various experiments like that along the way.